Hi everyone, so today I'm back with another mock USMLE question. This is going to be question number 20. So the question is, you have a 45-year-old female G1P0 with a past medical history of proximal atrial fibrillation and high blood pressure who comes to the clinic for a rash on her left thigh, figure 1, which I'll show you in a second. She first noticed a rash 2 days ago, which failed to resolve with the application of Vaseline. Patient denies fevers, chills, nausea, vomiting, but does endorse myalgias. Patient denies new household products, but states that she went on a hike recently about 1 week ago. Patient also endorses increasing fatigue, which she attributes to being pregnant. Temperature is 36.2, blood pressure is 133/94, pulse is 84 beats a minute. On physical examination, patient has a rash on the left thigh in figure 1, which I can show you right now. Here is what the patient's rash looks like. Pause the video if you need more time to take a look at the rash. Going back to the question, for the patient, CBC and CMP are unremarkable. What is the most appropriate next step in management given the patient's rash? The options are: give the patient ceftriaxone, doxycycline, amoxicillin, or levofloxacin. If you need more time, go ahead and pause the question right here. So the correct answer to this question is amoxicillin. In order to answer this question, first let's look at figure 1, which is the rash. This rash and the patient's clinical presentation that they tell us, which is this rash started after hiking, all of this clinical presentation is very concerning for Lyme disease. And this rash, erythema migrans that we see, is very characteristic of Lyme disease. Generally, the first line treatment for Lyme disease is doxycycline. However, in this case, we find out that this patient is pregnant. In pregnant patients, you can't give doxycycline because it can actually cause some issues in terms of teeth discoloration. So generally for pregnant patients, the first line treatment of Lyme disease ends up being amoxicillin. So this is incredibly high yield, and one general piece of advice I would provide as you're studying for the step examinations is not only should you remember the first line treatment for a lot of common infections like when it comes to pneumonia or osteomyelitis or Lyme disease, but you should also try to remember what is the second line in case the patient is pregnant or there are certain contraindications. Because I think we always remember that the first line in treatment of Lyme disease is doxycycline. But people often forget what the second line is in this case. So once again, first line is doxycycline. Now, if there's a contraindication, if you have a child who's young or you have a female who's pregnant, then the treatment in that case, one of the second lines could be amoxicillin. So in the next slide, I just want to go over like the really high yield things that you have to have memorized for Lyme disease as you're studying for your step examination. So the first thing is, Lyme disease, as we all know, is caused by bacterial infection by a spirochete organism called Borrelia burgdorferi. And remember, when I say spirochete, it refers to those spiral-shaped organisms, spiral-shaped bacteria. And there are 3 very high-yield spiral-shaped bacteria that you have to know. Like we discussed, one of them is Borrelia burgdorferi, which causes Lyme disease. The other one is Treponema pallidum, which causes syphilis. And the last one is the... and I'm blanking on the name of it, but it's the one that causes leptospirosis. So those are 3 high-yield ones that you really have to know when it comes to spirochete organism. And Lyme disease in particular is caused by, once again, Borrelia burgdorferi, a spirochete, which is transmitted through the Ixodes tick. With regards to Lyme disease, there are 3 stages which are very high-yield to remember: early localized, early disseminated, and late disseminated. In early localized, you often see we can often see constitutional symptoms like fevers, chills, myalgias, and then in early localized is where you'll also see that very pathognomonic rash for Lyme disease, the targetoid rash. It's also called erythema migrans. And just to take a look at it one more time, this is the rash. You should memorize this to memory right now if you don't already have that remembered. So that's, once again, early localized phase where you'll see often non-specific constitutional symptoms like fevers or chills, along with that targetoid rash. The second stage is early disseminated stage. So this is a stage where often you'll see things such as heart block and Bell's palsy. And this last stage is late disseminated stage, where often you'll see migratory polyarthritis. So those are three very high yield stages to remember for Lyme disease. And as I discussed a second ago, the treatment involves antibiotics. Typically, the first line is doxycycline. If there's contraindication to doxycycline for any other reason, the two options are amoxicillin and cefuroximine. And it's also, I think this factoid might not be as high yield, but I'll just include it nevertheless for sake of providing a comprehensive video. But for patients who have chronic Lyme disease for many months and years, in those patients, antibiotics are believed to be not as effective. So often they're not prescribed in that situation. But I think the vast majority of cases of Lyme disease, when you'll especially see it tested on step examinations or NBME examinations, are often going to be more acute stages of Lyme disease in which antibiotics will be effective. And so I think that's going to be it for today. If anyone has any questions on this video, feel free to comment down below.